Good morning, everyone, and welcome to the 8th annual conference of the National Confidential Inquiry into Suicide and Safety into Mental Health, more commonly known to many of you as NCISH. It's great to see the numbers of people, just everybody's coming in now. So we're going to make a start. I'm Jackie Morrissey from Samaritans. I'm your chair for the morning. And this is a real privilege as we launch the latest report from NCISH and hear about the recent research findings from the Centre at Manchester. We've got a fantastic number of you with us today. So please, I can see it happening already actually. Please introduce yourselves in the chat function. Brilliant to see all your names popping up, but also use the chat function for reflections throughout the morning. We've got NCISH staff who will be on the chat function. So any problems, any queries, put it in the chat and they'll respond as best as they can. We're going to spend the morning hearing from a whole range of speakers in turn. And then we've got a really great panel session towards the end of the morning. And that's going to be your opportunity to ask our speakers questions. So please, as we go along today, put any questions that you'd like me to ask the speakers, put them into the Q&A function. It just makes it a lot easier to spot them. So if you're all chatting away in the chat function, pull the questions out, put them into the Q&A function, and then we can try and ask as many as possible that we can fit into that panel session. So this session's being recorded. Great thing about that is if you want to watch it again, you'll be able to. It will be on NCISH's website. They'll need a few days to get it sorted, but it will be on there. And you'll also be able to find all the reports and the research which you hear about today on that website too. There's links to the website in your delegate booklets, which you should already have. But maybe someone can just also put a link to the website in the chat too, if it's not already there. We'll be tweeting throughout the day using the hashtag NCISH2022. So please get involved in Twitter as well. If we don't manage to answer all your questions during the panel session, the fabulous team at NCISH are going to continue to answer questions on Twitter throughout the day and possibly over the next few days. So please do keep an eye on that. NCISH has been building our understanding of suicide for about 25 years now, actually. And they've got an internationally renowned database of over 152,000 deaths by suicide. So this is both sort of an incredible as a source of information, but frankly, it's also a bit depressing because it's a stark reminder of how many people have died over that time. And for me, the really important thing about the work that NCISH does is the difference it makes. So the generation of all of this knowledge, that's really important, but actually it's the practical application of the knowledge, which is what it's all about. And the team at NCISH do some absolutely brilliant work to ensure that practical application of the recommendations coming out of the research. And these really are being used to prevent suicide. So we see that NCISH has directly changed patient safety in mental health settings. And now more widely in the community with the work they've been doing with local areas, research into middle-aged men, self-harm, real-time data, I'm sure many of which we're going to hear about today. But at the heart of suicide prevention, of course, is people. I'm sure we're going to hear a lot of stats today, probably going to see a few graphs, but we should never lose sight of the fact that this is about people we've lost to suicide, friends, families, colleagues, communities devastated by those deaths. And I know for all of our speakers, and indeed the whole team at NCISH, and for you in the audience, we'll never forget that as we talk about numbers, those numbers are people. And so with that in mind, please do look after yourselves this morning, take a break as you need to, as we go through the morning. And suicide research is all about listening and understanding the stories of people. People who've been personally affected by suicide have been a hugely powerful force for change in this country. And in my experience, NCISH, particularly Lewis and Nav, they've always had time to listen to those people who've been affected. And so it's no surprise actually that the first speakers today are people who've been personally affected by suicide. So I'm delighted to introduce our first three speakers. So they're known as the three dads walking. So Andy, Mike and Tim. Now, I literally only just met Andy, Mike and Tim about 10 minutes ago. but I first heard about them on the news, October last year? I don't know whether it was ITV or BBC. They absolutely got some fantastic coverage, well-deserved coverage, when they undertook a 300-mile walk, which raised hundreds of £1,000s for Papyrus, this excellent suicide prevention charity. But equally importantly, that walk helped get conversations going about suicide and help break down the stigma, which we know still exists. Now, I'm sure Andy, Mike and Tim wish in many ways that they weren't here, because of course they are here because they all lost their daughters to suicide, Sophie, Beth and Emily. But what's amazing about them is that they've taken this horrendous loss and they've created something hugely positive from it. So I'm going to hand over to Andy, Mike and Tim now, and I'm really excited to hear their story. So over to you guys.
Morning.
Morning, everybody. Right, we're going to try and see if we can share some slides with you. They've left me in charge, which is a bit worrying. How's that?
Excellent. Yeah,
brilliant, Andy. Brilliant.
Great start.
Brilliant.
A great start. Well, thank you, Jackie, for the introduction, and thank you, everybody, for taking time out to join the conference and listen to what we've got to say. So we are three dads. As Jackie said, we'd rather not be here, but we seem to have landed in this strange world of suicide prevention, which we didn't expect to be in. Our lives in the Airy family changed forever on December the 19th, 2018. We received a message in the family WhatsApp group from Sophie, our daughter, 29-year-old daughter, saying, I love you all so much, which it wasn't unusual to express love, but the form of words weren't right. I phoned Soph just to see if she was okay. It went straight to her voicemail, and I was just about to message her when her mum, so my first wife, George, phoned up in a complete state of hysteria, saying that she'd just got a message from Soph's estranged husband, Sam, to say he'd got a message from Sophie apologising for making a mess of his life, that she was going to kill herself, told him where she was going to leave the car, and signed off with "Please don't bury me." As you can imagine, our heads went to mush. We couldn't think of what to do. We tried to get hold of Soph again, but couldn't. So we basically jumped in the car and headed up to Edinburgh, which is where Soph and Sam were living, and spent 3 days waiting till eventually they found Soph's body 3 days later on the 22nd. The police had actually got to the car within minutes of Sam phoning them, but Soph had gone. Our world fell apart. We tried to put the day we lost, or we were told that we'd found Soph's body. We decided we had to do something positive, but we didn't know what. What we actually did was we were introduced to Papyrus through a friend, and that started our journey down the route of suicide prevention. So I think I better hand on to Tim.
Thanks, Andy. Can I just pass it forward the slide, chap, if you can?
It's not wanting to play the game.
Okay, no worries. So that's us. That's Sophie.
So, and that's Em.
That's Em. So Em was 19 when she died in March 2020. Em had a troubled upbringing in terms of behavioural problems, and she had we got her a late assessment in 2015, high functioning autism. And after that, she'd been under CAMS before that, but after that, her world started to be rebuilt, and she passed some GCSEs, got a job. Passed some GCSEs. She went to college, she got a job, she was working in the village pub, and then the pandemic hit. And the pandemic blew Em's world apart. And the things that helped with her autism were her job, which gave her money to run a car around, which gave her the freedom. She loved going to the gym. And basically, all of those, we started to develop COVID symptoms in the house. We locked down, and all of her, the things that gave her the release were taken away from her. And under our noses at home on Wednesday, the 18th of March, she tried to take her own life. We found her very quickly after that. She went to the hospital. She was on the COVID intensive care to start with. Friday night, we realised she wasn't going to make it. She'd been pulled off the COVID ward. She went on to the normal intensive care. And on the Sunday, we held her as they turned the life support off. She'd volunteered, or she'd gone on the organ donation register at the age of 11. She'd done that through school. So that was the kind of only ray of hope in that very, very dark time. Her funeral, 3 weeks later, the village was absolutely full, but the streets were all lined, there were 6 people allowed at it. And we just devastated afterwards. And we got home and my wife said, we need to, sorry, no one will remember Em in a year's time, which went to kind of sowed a seed in the back of my mind. And then I think I'll hand over to Mike.
Andy, Mr. Slideman, yes. This is Beth. Beth was the youngest of our 3 daughters. She was 17. We never saw that Beth was struggling. Basically, at the beginning of lockdown, the first week of lockdown, she started to struggle and she took her own life on the 28th of March. Beth was a larger-than-life character. She was a talented singer, dancer, performer. She was very funny. She had a huge social life. She basically had the world at her feet. She was so absolutely loved. She's one of those that's probably the last person in the world you think would take their own life. The devastating effects it's had, it's, as they say, it's the ripple effect. The ripples reach far and wide with her friends. The post-suicide effects are, yeah, they're still being felt now. My own personal journey is I was plunged into a world of complex grief. Everything became grey and surreal, and my mental health suffered so badly to the effect that I plan to take my own life too. Moving on though, things started to change. As time went on, started to grab onto why life was still worth living. And then I started to obviously become involved in the charity Papyrus. And I shall let Andy continue now.
Actually, you want to get hand on to Tim, I think, with this bit.
So what happened, it was exactly a month after Em died, my eldest daughter came up to me and said, Dad, I've been speaking to a bloke in Manchester. I was like, what? I've been speaking to a bloke in Manchester. And Annabelle, my eldest, had seen another family who had been through the very similar experience to us, and it was in the media. And she had reached out to Mike's daughter. Mike's daughter had put my daughter in touch with Mike, and they'd spoken. And so on the 22nd of April, exactly 1 month after Em died, Mike and I end up talking and just being kind of peer support, 2 dads in exactly the same place. And as Mike's already kind of alluded to, I was in a dark place. I think he was in a much darker place. And we started, as we went through the months after that, just to talk about stuff. Went on, Mind supported me massively, and it was then I realised the scale of suicide in the UK. And as Mike's already said, he started to get engaged with Papyrus. Mike's a bit of an outdoor type, has read The Atlantic and all sorts of stupid stuff. So he started talking about walking between Manchester and Norfolk. I'll hand over to you again now.
Okay, yes, myself and Tim started having ideas. We talked to each other regularly, peer support. We were both in the same place. We understood each other's pain, but we both felt with the type of people we needed to do something positive. We needed a point. And we started to talk about a few bits and pieces. And one was a walk between Manchester and Norfolk. That sounded great, so we chatted about it a bit. Then I started doing courses with Papyrus and suicide prevention, suicide awareness, and I started to hear about this guy called Andy, a very outdoor type, roughy-tufty Cumbrian, and he'd lost Sophie a couple of years before myself and Tim had lost Bethy and Emily. So I actually met Gregor, Andy's son, on one of the courses, and the idea started to form. What if we joined up with Andy? We'd make it Cumbria, Manchester, out to Norfolk. So I arranged to meet Andy, and we went for a walk. We had a talk, and I put it rather clumsily to Andy by showing him a 2010 roadmap with a few lines drawn on it. But Andy immediately said yes. Went back to Tim, told him about Andy, and the Three Dads from that moment was born. The little idea might have been mine, but these two guys have absolutely driven it. They're, yes.
Yeah, on that walk, which was very emotionally charged, Mike, wasn't it? We talked a lot about our daughters and how we'd got to the place where we'd been, and that feeling of we'd all, in the depths of grief and pain, had decided that we had to create something positive out of the mess that we were in, but we didn't know what. And this was Mike's idea. And I've got to say, the 2010 Road Atlas was just hilarious, and still is, actually. And then on that walk, it was when Mike then told me about this chap in Norfolk, and then we eventually got together.
Yeah. So we got together for the first time via Zoom on the 24th of April last year, and we instantly hit it off. Three dads in exactly the same place. Mike and I as peers supporting each other, but then looking to Andy as a bit of a role model, really, because he was kind of 14 months ahead of us. And the Three Dads Walking was born. 3 dads, 3 homes, 300 miles, and we try and raise £3,000 each, which sounded good. We'll try and do it across our friends and family. We met for the first time on the 2nd of July at Mike's house in Manchester, had a few beers, planned the route, and that was it. We were off. And we were ready to go. And we started to get loads of support from a load of people that Andy knew in the outdoor industry, but also everyone that we approached for accommodation and stuff was so supportive. And then Andy started to speak about the BBC. Andy, do you want to go on to that?
Well, a good friend of mine is Alison Freeman, who's the local reporter for BBC, based in Newcastle, but used to cover Cumbria. And so I've known her for 12 or 13 years. And she'd been very supportive after we'd lost Soph, and did a lot of promotional stuff within the BBC, and got it broadcast under a Run for Sophie hashtag, and we raised quite a lot of money doing that. But as I left Manchester, I said to these chaps, do you mind if I contact my Tame BBC reporter? And so I phoned Alison when I got home, and her first immediate reaction was, I'm sure I can get this on BBC Breakfast, because they've been talking about doing something about suicide and suicide prevention. We subsequently found out there was a lot of interest there because Dan Walker was a great friend of Gary Speed, and he really wanted to get his teeth into it. So that suddenly took it on to a different level. And the first time we were Alison actually came and filmed us all separately, me up in Cumbria, Mike in Sale, and Tim in Norfolk, which became a piece that went out on BBC Breakfast in September, and ended up with Mike on the Sofa with Jed Flynn from Papyrus.
Yeah, we never saw Three Dads Walking get as big as it has done. We originally wanted just to raise £3,000 each. We wanted to raise awareness. We wanted to start the conversation, push the stigma apart, and but the strength of feeling out in the world was absolutely overwhelming. You know, the BBC ran with it. Obviously, they gave us the exposure we needed. We had ITV Granada on as well, and all of a sudden we realised, you know, how many people have been touched by suicide on so many different levels. I hadn't got a clue. You know, I'd never put Beth and suicide in the same sentence. I was one of those who lived in ignorance. I didn't know what was going on around me. But as soon as we started to get out there a bit in the public, the amount of support, and the money's one thing, and the money's an indicator of what people feel. The money just started rolling in and rolling in. It started to pick up momentum. It was absolutely incredible.
Yes. So by the end of the first day walking, we'd had donations from Daniel Craig. We'd raised over £200,000 on the Just Giving. But more importantly, we'd realised that people who hadn't had a voice before were coming to see us and tell them about the loss of their loved one. And that started 500 meters from the start, where Amy's mom, beautiful lady, mom, 2 children. But Amy's mom, who's, I don't know, in her 60s or 70s, gave Mike order of service. Amy had taken her own life on the 29th of August that year. We walked on the first day with a 70-plus-year-old lady, Suzanne, whose daughter, who works in the NHS, doctor, I believe, had taken her own life. And this just became the story, if you like. Other people's story became the story. And some people were opening up for the first time in 70 years. There was one lady that lived in our village. She'd avoided us after M's death, but when she came and met us along the walk, and it transpired that her dad had taken his own life in 1953 when she was 3 years old. She'd only found out he'd taken his own life when she was 34, and she'd never spoken to anyone else about it until she met us and started opening up. And that's a lady I've known for 10 plus years in the village. So that seemed to indicate kind of the strength that was behind us. We became a focus for everyone. When people die by suicide, they die on their own. Their families feel very much on their own. There's the shame, there's a stigma around it. But because we didn't care about the shame and the stigma, we just seemed an outlet for everyone.
Every day we were approached by people who just wanted to share their stories. We were concerned for each other before the start, because we did wonder whether being loaded on other people's grief or pain would affect us. But actually what we found, it was a really life-affirming experience, very uplifting, because you could see people spending time with us, walking and talking, that they would start the day in a great deal of pain and stressed. But at the end of it, the sense of relief that they knew they weren't alone, I think, was just a incredibly positive thing. So it was fantastic for us, the 3 of us. It turned into a real massively positive thing. So I suppose we better cut to the finish, chaps, do we?
Yeah, so I think the big thing was that when we were walking, we realised that all these people had lost loved ones to suicide. And then we realised, with all the statistics behind it, that we put so much effort into other safety, road safety, terrorism, all this lot, but we don't seem as a society to be addressing the biggest risk to our young people. And this was borne out by Andy's son Gregor saying, well, why don't we look at it at PSHE at school? So we wrote to the government, and we ended up sitting down with Gillian Keegan to discuss putting suicide prevention on the PSHE curriculum. If this thing is killing our young people, then why don't we give the kids the tools to equip them to stop them doing that? If we do it early enough in life, in their teenage years, then perhaps the suicide rates will go down. As people get older, they'll have that coping mechanism. So that's been our big drive. So since we finished the walk, we raised 880,000. It's still going up. Each £5 is supporting a call to Papyrus's Hope Line. The Hope Line is going to go 24/7 in June, July, I think, Andy.
Yeah.
So that means young people or anyone that's concerned about a young person can phone up Papyrus, phone up their Hope Line UK and say, help, I've got a young person I'm really concerned about, or even the young person concerned, they can put a plan in place. So that was something tangible. But equally, our drive to get more suicide prevention rather than just mental health talked about at schools is a big drive for us. I don't know if you want to go into more, Andy.
Well, I think it's ongoing. I think that on that walk, as you said, Tim, it was that conversation that we had every day where we found people talking about deaths of loved ones, which were all different. But the conversation afterwards was very similar, where parents would say, we only found out that suicide was the biggest killer of under 35s in the UK after we'd lost our son or daughter. Why is nobody talking about it? So we became this shared voice. So we knew at the day we finished in Shouldham, it was the finish of that walk, but it definitely wasn't the finish of our campaign. So we're still on with it. And as Tim said, we are talking to the government. We have got an invite to talk to Department of Education in July, and there's various other conversations that are happening in the background. So we'll keep pushing on that. But Mike's had another idea, haven't you, Mike?
Was it my idea? Yes.
It wasn't mine.
It's very evident. The praise we got and the feedback we got after the first walk was amazing. And people were saying we'd accomplished so much. But as Andy and Tim are saying, we realised we weren't finished. Suicide, young suicide, was still going on and is still going on now. So what we realised is, how could we make a difference? And you're right, putting it into curriculum schools, you know, we believe really should be introduced to primary school level, age appropriate, then built on through secondary schools and into higher education. Equip our young people so they can carry this knowledge, this skill, this awareness through their lives, not just for themselves, but for their loved ones, family, friends, colleagues. It's, you know, it's an obvious thing to us. And well, saying the Three Dads isn't finished, we are going to walk again. We are going to walk again this September. Tim or Andy, do you want to expand a bit more?
I think
that's amazing.
It's coming to a town or city near you, I think we need to say, aren't we?
Yes. Yes.
We will update our website, which is 3dadswalking.uk. We'll update that hopefully by the end of the month with our plans. So yeah, watch this space.
Thanks. Thanks so much, everyone.
Yeah, thank you.
Thank you.
Brilliant. Thank you so much, Andy, Mike and Tim. Yeah, really looking forward then to the next walk. That sounds fantastic. And yeah, it was a really honest and powerful talk you've just given. And I know many people watching this will really recognise the importance of both that peer support that you talked about and that shared experience. It's incredible what you achieved. You know, what did you want? $3,000 each, and you've got over, well, kind of nearly 900,000. Absolutely astonishing. So thank you for being with us today. Thank you for sharing that. And actually, thank you sort of on behalf of the whole suicide prevention sector, because getting people to recognise that feeling suicidal isn't something that, oh, well, it will never happen to me and my family. You know, this sense that somehow it just happens to other people, getting people to recognise actually that suicide really is everybody's business, opening up those conversations, that's how we save lives. So like we can really feel the kind of passion and emotion coming out of you all today. So thank you. I know you're all really busy. So we do appreciate the time, but if you can, do have a look at the chat before you have to disappear. There's a huge outpouring of support and thanks for you on the chat. So if you can, just spend a bit of time reading through those messages because that will show how really kind of pleased people are that you've been with us today. And good luck.
Yeah,
I'm going to say
Thank you.
the next challenge.
Thank you.
Brilliant to have you with us and enjoy the rest of your day. Thank you.
Thank you.
Thank you.
Bye-bye. Thank you all.